Along with social distancing and wearing masks, one thing that is not going away soon is having to be in quarantine.
If you come into contact with someone who has COVID-19 or if you test positive for it yourself, the CDC suggests that you isolate for 14 days. But it is not that simple for some workers, finding that they are dealing with pressure at work or even potential retaliation if they return after having to isolate. Joining us live to talk about some of the questions around this issue is Oregon OSHA Administrator Michael Wood. Michael, good morning. Thanks for joining us.
Good morning. Happy to be here.
Yeah, so let's first just get into this issue of if you have to quarantine, if a doctor, if medical professionals are saying you should quarantine, what is your employer supposed to do in that situation?
Well, it's actually very clear in the emergency COVID-19 rule that I adopted last month. And the basic guideline is if a doctor or public health official says that someone needs to be in quarantine or be isolated, the employer has to comply with that and has to see that the employee is not at work. They can work from home if they're able to do so and if their health permits, but otherwise they need to not be working. And it's not an option for the employer. And in addition, they can't take any adverse action. They can't do anything to adversely affect the employee's future employment if simply because they quarantined due to COVID.
Now, Michael, if your employer does retaliate, how is a worker supposed to report it?
Well, because it's a violation of the rule, they can report it to Oregon OSHA as a complaint under our rule. And the easiest way to do that is to go to OSHA.oregon.gov. And on our front page where it says get help, there is an option that says file a complaint. If possible, they should try to work it out with their employer first. And the employer is prohibited from retaliating against them for raising the issue or discussing the issue. The important thing is we need to have people who are sick staying home. And unfortunately, we've gotten reports that employers not only aren't requiring it, there are employers who are insisting that sick employees come to work.
Yeah, I know that's really the ultimate goal in all of this and trying to slow the spread. When we talk about employer retaliation, it's not always as cut and dry. As an employer saying, no, you need to come to work, or now I'm going to do this to you. What are some of the situations that we're maybe seeing, things that employees, could look at and say, oh, this is considered retaliation?
Well, it could include things like assigning them to a different job when they return, or taking away seniority, taking away pay. The obvious thing is terminating them. And frankly, in too many cases, that's what we're hearing is the employer is simply saying, you need to come to work or I'm firing you. We're an at-will state, but that doesn't mean that employers can retaliate for safety and health issues or violate safety and health conditions in the workplace.
Now, take the position here of some employees who may notice that their workplace and their employer may not be taking all the precautions that they can to slow the spread of the virus. What are those employees able to do?
Well, they can also file complaints with us, and we get right now a lot of those complaints. We've gotten about 10 years complaints in the last year related to COVID-19, but they go to the same website, OSHA.oregon.gov, and file a complaint indicating the concerns they have, and we'll reach out to the employer and try to resolve it. We'll inspect and issue citations if necessary.
Wow, a decade's worth of complaints in a year goes to show just how far-reaching and widespread this issue is for so many workplaces, but good to know that there are avenues out there to say something. Michael Wood from Oregon OSHA, thank you for joining us this morning.